Hello and welcome everyone. This is another edition of Big Interviews at the DAMS studio. I have the pleasure of welcoming Dr. Sabha Ahmed today. Our student from Bangalore who has been a real winner all the time. He secured a rank of 69 in AIIMS, rank 34 in PGI and rank 9 in NIMHANS. That's great, wonderful. We are really happy to share this information, and I personally feel if there would have been another exam, this would have come to top 3. 69, 34 and 9. We are very happy to welcome you today in our DAMS studios. Dr. Sabha, please tell us, how are you feeling about your success?
Thank you, sir. Thank you for that amazing introduction. It feels great. I'm on top of the world, and like I said, I'm relieved, very relieved that I would be able to join the course of my choice at the Institute of my choice, which has been the goal from the very beginning, and DAMS has been a very integral part in helping me achieve that. So thank you.
Well, we must thank you that all the hard work our faculty has been putting in teaching students has given good results by securing such ranks in difficult exams like AIIMS, PGI and NIMHANS. Dr. Sabha, before this interview you were telling me that you have enrolled yourself in our Bangalore branch in the foundation course, and then subsequently you tried the T&D also, the test and discussion course. May I ask you, how was the classroom experience with DAMS?
Sir, I joined DAMS as a foundation student when I was in my 3rd year. So we started off with the basic sciences, and that really helped me gain a grip over the final year subjects, because once you're very thorough with your basic sciences, the final year subjects like medicine, surgery and OBG become relatively simple. And also before entering the final year, I had the opportunity to attend the sessions held by the faculty for medicine, surgery and OBG. So I had a good idea about what I'm supposed to study and what I'm supposed to understand subject wise before entering the final year. So that really helped me give a good performance even in my professional exams as well as in my PG entrances.
And also, when you were taking the classes, let me just mention about our CRS, that is the comprehensive review series that we give to all our students, which is based on the standard textbooks. How did that CRS help you? And also, if you can just tell us about the Last Look series and the Harrison's notebook.
So coming to the CRS, I think CRS can be used as an adjunct to your standard textbooks in your professional years as well as your PG entrances. So according to me, taking down notes in the class and then going through the CRS would be a good idea, because that will give you a wholesome approach to a subject. Coming to the Last Look, I think Last Look is really up to date with respect to all the latest developments in Harrison's, be it especially PSM, because every other year you have a new edition coming up. So PSM Last Look was really helpful, so was pathology and pharmacology. But Last Look, I think once you are done with the CRS and your notes, then Last Look would just add the cherry on the top.
Well, that's very nice to know. And I still remember before this interview you were telling me about the talking CRS. Can you just tell how did that help you?
Yes, sir. So the talking CRS is the latest edition I think they've added this year. So I feel that like when a huge book like CRS is being read out to you, and every page the important points are being read out to you by a faculty, that really adds to your knowledge, because I'm an auditory and a visual learner. So when someone is telling me, I tend to retain better.
Well, that's very nice to know. And let me tell my viewers here that talking CRS is something unique about DAMS. We are trying to help students. We're not just teaching, it is more about mentoring the students to get the desired results. Any faculties at DAMS you remember you would like to mention here especially?
Absolutely. So I think the first lecture was the ENT lecture by Dr. Deepak, and that really opened my eyes as to how you should view a subject. He told us to just sit in the class, try to understand the concepts and then write your own notes. So I followed the advice for every other subject after that, and I've been a fan of Dr. Khandilwal since my pre-foundation years. I think he just simplified Bailey general surgery, which is a huge subject, very concisely, very meticulously. And I also got to attend Dr. Deepti ma'am's class here. That was brilliant. Her notes are the end all to surgery. They are literally OBG. They are absolutely gold. And I think in the AIIMS exam we had a good portion of OBG this time, so that really helped us crack most of the question in AIIMS. And obviously Sumer sir, he's a mentor, and I think there's no end to radiology, but he makes the subject very simple. And like I said, every faculty, if you just go by the notes and the CRS, that is more than enough.
Thank you for your kind words, and let me remind my viewers here, we're talking to Dr. Sabha Ahmed, our students from Bangalore, who has secured a rank of 69 in AIIMS, rank 34 in PGI, and rank 9 in NIMHANS in the postgraduate medical entrance exams conducted in May 2018. With that, I would like to know, as I've already mentioned, that you have been a foundation student. So we, as a practice at DAMS, conduct a lot of tests. With that, I'm referring to the subject-wise tests, the grand test, and the class test that we do. How did you find these tests were helping you while you were preparing?
So as I've mentioned before, I was actually an MLE aspirant. So moving from the MLE track to the Indian PG track, I think the subject-wise test and the grand test, they played a very important role in helping me streamline my preparation. Because according to me, the knowledge is the same, but how you apply and the kind of questions that are asked are different. So to streamline your preparation, you need a very concise test series. So I think I relied, especially for the short subjects, I relied solely on the test series, and the GTs were very useful. So I gave approximately, I think, 4 GTs before appearing for the May exams, and I watched all the videos. So what I feel is that in the GTs, when you're given a question, like supposing in physiology, the video of that particular question, it covers the lateral topics as well. So you get to cover a lot more topics in one GT. It's 300 MCQs, but you're covering almost 100 to 1000 to 1200 topics. So that is very high yielding.
Well, that's very nice to know. And let me just ask you one more thing. When you're aspiring to take exams like NIMHANS, PGI, and AIIMS, then the examination pattern is quite different as compared to the NEET. How was your examination experience in the light of the fact that you have spent time with DAMS teachers in DAMS classroom? How was the actual exam experience?
Like I said, sir, I think Deepak sir had mentioned in the very first class that we have to understand the concepts really well. And once the concepts are engraved in your head, the rest of it just comes. And especially the centrals, be it AIIMS, PGI, or JIPMER even, they concentrate a lot on the basic sciences. Even for that matter, NIMHANS, I think if you are very strong with the first and second year subjects, you can crack it very easily. So I made it a point to understand the concepts well, and the notes followed. With respect to AIIMS specifically, I think the TND was very structured. Like most of the questions, I would not call it an AIIMS TND, I would call it a central exam TND, because it covered topics which are important AIIMS wise, JIPMER wise, and PGI wise. So that really helped me gauge the important topics, concentrate on them, and really solidify my knowledge.
Well, all the questions that are solved in the class or that are taken by the teachers in the test and discussion, and otherwise also in our grand test and subject-wise test, could you find some similar questions or almost?
Absolutely, sir. Right. Most of the questions are either derived from the topics which have been asked, or very few of them are direct repeats, but most of them are derived from the similar topics which are asked in centrals. And given the fact that now centrals concentrate on asking new questions, I think DAMS has a very high strike rate. With respect to the new questions which are asked in centrals. All the topics which could be anticipated are covered in the tests and discussions. So when we appear for the main exam, we are not baffled or taken aback by any new questions.
Well, that is wonderful to know, and I hope all our viewers and all our listeners are going to benefit themselves by these wonderful inputs given by Dr. Sabha Ahmed. I'll just go a little offbeat here, Sabha. We have a Facebook club, a DAMS exclusive club. Did you have a chance to interact at that club, or what was your experience like?
Yes, sir. Actually, I have been a part of the club from my foundation years. So from then, any doubt I have, I used to put it up on the club, and within a blink of the eye, the faculty would have answered it. So that was really helpful. Also, I think when you're in a club, like I think the club has around 30,000 members. So you are constantly in that zone of PG prep and everyone studying. So you get very inspired. And also Sumer sir and Diksha Sikri ma'am, they put up really inspirational posts. So that really helps on Monday nights. And also the fact that other aspirants put up questions and doubts of their own. So when you browse through the club, you get to know the common doubts which other people have, which you might not have thought of, and that is solved then and there, and that gets engraved in your head, so you never forget those questions.
That is very rightly said. A wise man always wisens with the experience of others, and a topper is always benefited by the doubts created by others. I'm talking to Dr. Sabha Ahmed here, a student from Bangalore, and who secured wonderfully who has done wonderfully well in the recent exams conducted by AIIMS by securing of rank 69 in AIIMS and rank 34 in PGI, and not to forget rank 9 in NIMHANS. That's great. Every time I speak these figures, every time I utter these words, I feel happy from the core. Coming back to the academic part once again, we conduct a DVT every year. It's a 3-day session for the information of our viewers, wherein all the images of that are expected to come in the exam or which need to be educated upon to the students are discussed. Did you take the DVT session?
Yes, sir. So it was a 3-day session at Bangalore, and I found it very high yielding because all the subjects and most of the high yielding topics are covered within a span of 2 hours for each subject. Like I said, I think pharmacology, the entire syllabus was discussed in a span of 2 hours. Deepti ma'am's sessions are always high yielding, be it her classes or her notes or the sessions she takes in DVT. All of them are extremely high yielding. I think Path, we get to see a lot of images. Like you said, it's a visual treat, so it's very literal to its name. It gives us an idea of the kind of images we can anticipate in the centrals, because now AIIMS, JIPMER as well as NEET, I think they do tend to ask a lot of images. So we are acquainted to the images and we are given the concept behind the images, so we can crack any question related to that. And surgery also, like PGI tends to ask a lot of questions on sutures and general surgery as such. That was covered in DVT. Although it was an image based session, I think a lot of the questions were derived from those and we could solve them even in PGI.
Well, I'll ask you a very direct question, my favorite one. How many questions do you think would have been derived from our DVT?
Sir, I think that's a pretty hard question to answer, but I think around 50 to 60%. Because DVT covers theory as well as the images. So if you go by the lateral learning you get from a single image, you can actually get around 5 to 6 questions from each subject right at the main exam. So definitely a huge portion of the questions.
Well, that's very wonderful to know, and I think we are getting very knowledgeable information here which is going to help all the aspirants in the coming times. We have also launched a eMedicos app recently. Did you get a time to browse through that app?
Yes, sir. So I wasn't very active on the app and club last year, but this year I had a very short span of time, I think around 4 months of serious prep. So the app really helped me keep in touch with what has been happening till date, because I think the November AIIMS, all the videos, the solution videos have been updated, and the integrated medicine videos of Sumer sir along with Diksha Sikri ma'am, or for that matter even with the microbiology faculty, they have been really helpful. So the integrated approach is really useful now, because AIIMS and PGI, they ask a lot of integrated questions. It's not just patho or specifically surgery related. It's an integration of the basic sciences with the clinical sciences. So those videos were of great use. Also, the faculty has come up with this Wednesday EQ series.
Yes.
So every Wednesday we have a new MCQ which is discussed. And in light of that MCQ, the related topic is also discussed. So in a short span of 5 to 6 minutes, we are given an insight into the topic and the related questions. So that is extremely high yielding.
Thank you very much, and I think all those who have not yet downloaded this app, this is a free app available to all the medicos of the country, and it's going to help you a lot. You get to know the fraternity, you get to know what's going trending latest in PG, otherwise also what is the new advances, recent advances in various branches. You get to know there, and it's a free app available at the Google Store as well as the Apple Play Store as well. Before I wind up this conversation, Dr. Sabha, let me know if you have any message for your juniors.
Sir, I think I've just learned that you should keep your standards really high. You should always aim for the stars. There's nothing that can stop you, and you're your only limitation. So there's no there's no other way around. It's hard work and just hard work. So.
Well, that's very good and very wisely put here words, but let me ask you directly, would you ask or would you recommend DAMS to your juniors?
Absolutely, sir. I think that given the climate now of so much competition, it's better to start early. It's better to get your sciences, basic sciences very strong, because once you're done with that, then the rest of the journey is relatively easier. So joining the foundation course really helps you in understanding your professional subjects for your patients as well as for the PG. So it's a win-win either way. I don't see why anyone should wait until internship or post that to join the course.
One last quick question. Have you made up your mind which branch you are going to opt and where?
Sir, I'm confused between AIIMS and PGI. So I have my options of radiology and internal medicine as of now.
Well, we wish you all the best with that, and in any case, wherever you choose, whatever branch you choose, the country is going to be benefited, because a great doctor, a wonderful brain, is going to become a postgraduate with great knowledge and application. This was an interview with Dr. Sabha Ahmed, who has done exceedingly well, a Damsonian from Bangalore, who has secured a rank of 69 in AIIMS May 2018 exam, ranked 34 in PGI May 2018, and ranked 9 in NIMHANS. We wish you all the best in life. Thank you very much.
Thank you, sir. Thank you so much. Oh,